Okay, as we migrate. Good morning, everybody. Thank you all for being here. I'm going to start so we can keep us on time. For those who I don't know and for those who are watching online, I'm Sandro Galea, and I have the great privilege of serving as Dean of the School of Public Health at Boston University, and to welcome you here all today. Just to frame what we're doing in just a couple of sentences, as I see it and as we have written and discussed at this school, and as I know with all our colleagues and peers in our schools of public health, schools of public health do three things. We generate knowledge, we teach our students, and we get the next generation ready, and we work with the outside world to make change happen. And at the heart of all this, from my perspective, is teaching. We would not be schools if we weren't teaching. We would not be schools if our role were not investing in the next generation. So the genesis of today was very much a set of discussions that I was having with many colleagues, particularly Dean Lisa Sullivan, who I'll introduce in a second, around teaching and about our commitment to being the best possible teachers that we can be. This is an extraordinarily exciting time in terms of teaching and teaching public health, because the world is changing, the world's needs are changing, and how we teach and what we teach and when we teach and the modality in which we're teaching is changing. It's all changing. Now, one can look at change as terrifying, which in some parts it is, but one can also look at change as exciting, which I would actually prefer to think of it as being. So I think the change is exciting, and we really set about convening this group today, which is centered around the book that Dean Sullivan and I put together with many of you participating in it, to ask ourselves these questions. How should we teach better? What should we be teaching? When should we be teaching? What modalities should we be using? And really, in the process of engaging with many of you, I have learned an enormous amount. And as we started getting folks contributing to the book, we realized, wouldn't it be something if we can actually get us all together in a room so we can learn from each other? So as I see it today is one of those immense luxuries that one has by having a day job in an academic institution, where we can actually sit here and learn from each other. I am truly delighted to hear from all of you and to learn and to emerge at the end of the day hopefully much smarter than I am right now at the beginning. And I think for all of us, hopefully, it's an investment in our teaching and in our students in the future. So thank you very much for being here. We have people who have come from quite far away. I think the furthest away is from Moscow. And thank you all for actually making the trip to being here. That's it. That's actually all you're going to hear from me. I'm now going to introduce the people who are actually going to be telling us things of substance. But I'll start with the Provost G. Morrison. We're delighted that Provost Morrison is here with us today. Provost Morrison, by way of introduction, has been University Provost and Chief Academic Officer of the university since January 2011. In that role, she provides leadership for the university's overall academic planning programs. She is the second ranking officer of the university after the president. And since her appointment, Provost Morrison has overseen an enormous range of efforts to enhance the academic quality and global competitiveness of the university, including the launching of the University-wide Arts Initiative, the establishment of many different associate provosts to lead the school's graduate education efforts forward, and most recently, the reconfiguration of the entire teaching curriculum in the undergraduate, which is called the BU Hub, which I believe has kept her awake for the past 2 years consistently. By training in her scholarship, Provost Morrison is a geologist. She does research in earth sciences, focusing on understanding the evolution of the Earth's crust over time, which means it's things that I don't understand at all, but I always enjoy learning from her. Before she came to BU, Provost Morrison was a professor of earth science and executive vice provost for academic affairs at the University of Southern California. She's also a professor in the Department of Earth and Environment, and she has a PhD from University of Wisconsin-Madison. And as a citizen of the university, I actually feel with great confidence in saying that we have an outstanding provost who really is committed, not just to how all the schools are doing well, but really committing to making this the best possible place for our students. Provost Morrison.
Thank you, Sandro, for that kind introduction. It's a great pleasure to welcome so many distinguished educators from around the world to our campus, particularly from as far as Moscow, for what promises to be an invigorating day of presentations and discussions and important new connections in public health research and education. To all of you, public health deans, presenters, members of the BU community, I want to thank you for being here today. And to give special acknowledgement to our Dean of the BU School of Public Health, Dr. Sandro Galea, and to Associate Dean and Professor of Biostatistics, Dr. Lisa Sullivan, for their leadership and outstanding efforts to advance the teaching and practice of innovative health solutions for populations around the globe. I'd also like to recognize two national leaders, Dr. Georges Benjamin, CEO of the American Public Health Association, and Dr. Laura Magana, CEO of the Association of Schools and Programs of Public Health, who've made the trip to Boston to join us today. The work that all of you in this room are doing to improve access, understanding, and quality of care for countless communities, both urban and rural, cannot be overstated. Nor can the impact you're having on new generations of researchers, practitioners, and teachers of public health. All of these activities are essential to the mission of a truly excellent and engaged research university. The bridging of disciplines, the training, and the production of new knowledge and practical discoveries that positively impact quality of life and provide the foundation for future exploration. The importance of your work is as critical as it's ever been. The fact is that despite progress in reducing poverty and increasing the standard of living, more than a third of the world's population remains underserved in health, education, and essential services. At a time of exploding urban populations, unpredictable outbreaks, and widening disparities in many regions, it is incumbent upon research institutions and our partners to be a laboratory and proving ground for new ideas that are not only responsive to existing needs, but can also help to predict, mitigate, and prevent future challenges. Essential to this is, of course, educational programs that are dynamic and relevant to a changing world. At Boston University, we're proud to lead on this front, with Dean Galea out in the front of that effort, with continuing and evolving curricula that combine foundational learning with practical training in a host of areas, from nutrition and biostatistics to epidemiology, and with the recent renewal of our MPH program, which offers specializations in 17 interdisciplinary certificates. It's a story that should be familiar to most of you in this room because you're doing the same things and the same vital work at your own institutions. And that's why all of us are here today, to learn from each other, to share approaches, innovations, and best practices, and to hopefully come away with new connections and ideas for teaching public health and improving quality of life for all. In just a moment, I'll welcome Dean Galea and Sullivan to the podium to get the symposium underway. It was their recent book, Teaching Public Health, which includes chapters by several of today's presenters, that was the inspiration for today's event. As with that book, it's the aim of this symposium to spark a whole new set of conversations and an exchange of ideas that can inform our collective work and advance our respective missions in service to our students and our communities. It should make for an incredibly lively set of discussions. I want to thank everybody again for being here today and for your engagement in this symposium. And I'm now delighted to welcome Sandro back to the podium. Thank you.
Thank you, Provost Morrison, for being here. One of the great joys of coming and joining a great institution like this is getting to work with people who are better and smarter than you. And that was definitely the case when I joined here and started working with Dean Lisa Sullivan. Dean Sullivan is, simply put, one of the most committed, dedicated teachers I've ever met. And she has duly been recognized for that. She's the co-author of a textbook called Introductory Applied Biostatistics. She's the author of Essentials of Biostatistics in Public Health. She's the editor-in-chief of the Encyclopedia of Clinical Trials. She is an outstanding teacher and has received really all, I actually could go on and on, but I won't. Every relevant teaching award she has received. But more importantly, from my point of view, is not that Dean Sullivan is outstanding in the classroom. She's truly committed to thinking ahead. Where is our teaching going? How can we best structure our educational program? And one of the things I learned as soon as I got here is to listen very carefully to Lisa. And this symposium is really Lisa's brainchild, as is the book, and it's my privilege to work with you every day. Lisa.
Okay. Thank you, everybody. Thank you, Provost Morrison, Dean Galea, for your unending support of education. It's such a privilege to be here, and thank you to all of you for coming. I really don't know how to work this thing. No, I've shut it off. Okay. It's the big green button for everybody, okay? It's an exciting time to be in public health. We've had tremendous growth in public health. The number of programs is up to 115 as of 2017, the number of schools to 64, and standalone bachelor's programs is at 9 as of 2017. We've also had tremendous growth in applications over the past 40 years, and we're seeing tremendous increases at every level of education. We have growth in our graduates at every level, and more importantly, our graduates are going into every sector, bringing the public health lens to all industries. The faculty headcount has increased more than threefold since 2005, and our faculty represent a range of areas of expertise. Coincident with all of this growth, we are all redesigning curricula. Thank you to Dean Peterson and many of you in this room for the Framing the Future effort. That gave us a revisioning of public health education over all the degree levels. We also have the new accreditation criteria that came out as of 2016, which represent the most significant changes in accreditation criteria since the establishment of CEF. But changing curricula is not all we need to do. We have to rethink pedagogy. It's as important as changing curricula. Change can be exhausting and exhilarating. How do we stay on the exhilarating end of things? We have a tremendous opportunity to shape the future of public health education. We suggest we need to change this narrative from change is hard to change is exciting. Many of us had the great opportunity to hear from Dr. Pearson at the ASPPH meeting, who suggested we need to be more agile, test and learn, and embrace our failures. We also suggest we have to model professional confidence in the face of uncertainty. We have to ask our faculty to do this as they're teaching things that they never taught before. And we suggest the way to get there might be thinking about three principles. Public health education is relevant, authentic, and practical. Public health education is inclusive, and public health education is ongoing. These photos are from the 1970s, and I'm raising them just because we've got a different set of photos that we could put up representing the issues that we're all dealing with today. But in the 1970s, we had issues such as the Kent State shootings, gender equality, the Vietnam War, Watergate, the energy crisis, although Steakburger may have more issues than just the energy crisis. And how did people deal with all of those issues? Well, perseverance and inspiration. In 1975, a song came out that inspired a lot of people to take action against these very issues. And I'd like to suggest that that song is an inspiration for the issues that we have to deal with today. I wish I could be up here singing this song to all of you. I think that would be tremendously inspiring, except I have no singing talent whatsoever. But I am going to read these lyrics because I think they're incredibly important. This is a song, came out in 1975 by Harold Melvin in the Blue Notes. And if you know it, feel free to read it along with me. I cannot sing it, but I'm going to read it. Wake up, everybody, no more sleeping in bed. No more backward thinking, time for thinking ahead. The world has changed so very much from what it used to be. There is so much hatred, war, and poverty. Wake up all the teachers, time to teach a new way. Maybe then they'll listen to what you have to say, because they're the ones who's coming up and the world is in their hands. When you teach the children, teach them the very best you can. The world won't get no better if we just let it be. The world won't get no better. We got to change it, yeah, just you and me. We can do this. We can change the world, and it starts with education. Thank you, all of you, for being here. Welcome to the Boston University School of Public Health, and I look forward to an exciting day. Thank you.
Thank you, Lisa. We are very fortunate to have with us to MC today Keri Goldberg. Keri Goldberg covers health and science, is the editor of the Common Health blog for WBUR here in Boston. She has been the Boston Bureau Chief of the New York Times, staff Moscow correspondent for Los Angeles Times, and a health science reporter for the Boston Globe. She did a Knight Science Journalism Fellow. She has graduate work at Yale and Harvard. But I actually think, apart from her astonishing career in journalism, what's very cool about Keri is her memoir, which is called, I just love the name of this book. It's like one of those things I wish I had thought of. 3 Wishes, a true story of good friends, crushing heartbreak, and astonishing luck on our way to love and motherhood, which I think is fantastic. This is the last you'll hear from me till the very end. Keri's going to take us from here on the rest of the day. Keri, thank you for being with us.
Thank you, Sandro, and welcome everybody. And I have to say to the person who's here from Moscow, добро пожаловать в Bostonский университет. Мы очень рады вас приветствовать, because I misspent half my youth learning how to decline Russian nouns. And it's a great honor to be your MC today. As a health and science and medical reporter, I drank your Kool-Aid a long time ago, and I'm very aware that of all the things I cover, it's public health that makes the most difference to people's lives. Although I must say I'm having a feeling right now, you know those horrible anxiety dreams where you're back in college and you're about to take the exam and you think, wait, did I take this course? Well, right now I'm feeling like, wait, did I study public health? Did I get a PhD? But I feel like I can serve a function here, first of all, to run the trains, which is the main thing I'll be doing, and second of all, to possibly offer a few words at the end about what struck me most as a naive listener. And I would like to just offer one additional point as a member of the media. I know you're talking more about teaching today than about reaching out to the outside world, but I really do think that Sandra Galea is a model for how you can reach out to the outside world. I have never encountered a dean of an academic dean who was so willing to just speak out on things that are clearly right or wrong. And I think he really puts the public in public health and could be a useful model to many of us here. He tweets, he writes guest posts, he's out there saying, look, this is what these policies mean for people and people's health. And I salute you.